Following breast cancer surgery or radiation treatment, there are limitations that are very typical in the shoulder range of motion. So one of them is shoulder flexion, which is raising your arm straight up with your palm facing your body. It can be very painful to move through these planes of motion, and it can affect your activities of daily living. So it's incredibly important for you to do exercises that will help you safely and effectively regain your range of motion and perhaps be even better than you were prior to surgery. But do not begin lifting weights in that plane of motion until you have what we would consider normal range of motion. So you can compare it to your unaffected arm. One thing you can do is simply just sitting upright and raising your arms up as high as you can repetitively, and it's best done against a wall. That way you can keep your shoulders back and down. Now I'm sitting on this exercise ball, but you could be standing or you could be sitting in a chair and just raising your arms, and you can do one arm at a time. You can just work the affected arm, which is the side that had surgery. You can even use your other arm to push it just a little further, which is called active isolated stretching. Alternatively, and I really like this because it helps to stretch my low back as well, you could be sitting at the kitchen table. This could be your kitchen chair, and this could be your table. You could be at your desk at work. The bottom line is use your imagination. But what I'm going to do is I'm going to place my palms facing one another and drop my head, and I'm going to slowly allow my arms to go forward until I feel a really good stretch. Now, if it hurts you, you can back up a little bit, and then if you don't feel much of anything, then you can go even further. You can also do abduction like this. We had another video for abduction, but abduction is movement of the arm out to the side. So you can also lean into the chair sideways. Now, that would work better at a table because it'll be higher and you can just lean into that. Don't overstretch. It should never be painful. You will feel a mild stretching sensation and there can be some discomfort. Start with just a few repetitions or holding it for a few seconds, gradually increasing it to hold it for 20 to 30 seconds. And if you have any burning, tingling, numbness, heat, pain, and swelling, please consult your doctor right away to rule out the risk of lymphedema.